Hey guys, this is Dr. Patel with Harmony Oral Facial Surgery. I'm a board-certified oral and maxillofacial surgeon. So today we're going to talk about medical emergencies in dental office. This can happen almost anywhere, anytime, parking lot, in your waiting room, or even in your dental chair. And it's important to be ready for emergencies when they do happen, although they don't happen that often. Have your team do a little mock run through to make sure that everyone knows where all the emergency equipments are. Now, I'm an oral surgeon and we do IV sedation here all the time. So we actually have a full-on crash cart here with all the emergency rescue drugs and a little crash emergency scenario as well, in case somebody needs to look it up. And it gives you step-by-step on how to handle any airway or cardiac emergencies. And then we also have stethoscope and all armamentarium here. Now, I understand most dental offices wouldn't have any of this, but one thing I can recommend is you should definitely get medical emergencies in dental office book. I don't have any affiliation with them. I don't really gain anything, but I do think that people would gain some sort of extra support by having something like this. It's easier for a team to look at and understand as well. So the basics is to always make sure you have a good medical history on every patient. The consultation appointment tends to be a little chaotic, you're busy, but just take down time to get their medical history, their surgical history, any medications they're taking, allergies, any social history, they smoke, do they vape, if they ever had any reaction to any local anesthetic or otherwise, and how was it handled, or if anybody in the family had any issues. It's important to jot down all of this. And then once you have full list of medications, then you have even better understanding of their health. Is this a person that's been taking 3 or 4 blood pressure medication and their blood pressure is still high? Then it's someone who's probably gonna be on the higher side, Or is this a person that has high blood pressure but is not taking anything? And a lot of people will come here and say, oh, it's the anxiety, or oh, I'm in pain, which sometimes is true. Then have them go home and take it from home, record it, and send that to you. So you could be sure that that's what it is. And if it continuously keep coming high and they're like, oh, I'm not nervous, it's never this high, then it's probably a conversation that they need to have, that they need to go see their doctor and get this addressed. So let's talk about blood pressure, okay? 120/80 or less is what we're looking for in terms of normal, okay? Anything above that, there's pre-hypertension, there's stage 1 and stage 2, and we'll put up the guidelines here for you to take a look. Hypertensive crisis, anything that's reading over 180/120, that's a bit of a red flag. I would retake the blood pressure and make sure it's still reading that high, or is it coming down? If it continues to read high, it's probably best for you to reschedule the procedure and have them check it out with their doctor and make sure that they don't need to get on any medication or anything to get this under control. Hypertensive crisis can happen anytime, especially with local anesthetics. Normally we try to use lidocaine with epinephrine for many reasons, but there's limitations to that. Usually we want to limit it to 2 carpils or less. However, always important that you aspirate and make sure that epinephrine doesn't go into their bloodstream. If they already have high blood pressure and epinephrine's to go into the bloodstream, it can really shoot it up and really put them in hypertensive crisis. I will tell you, most people with high blood pressure may not exhibit any symptoms whatsoever. They may not complain of headaches or blurriness or confusion or palpitations, none of that. So what do? Well, if they're asymptomatic, send them to the doctor. Hypertensive crisis, if they are getting short of breath and agitated and palpitations and short of breath, you want to make sure that they get emergency attention right away. Call EMS, send them to emergency room, and get that taken care of. You don't have any antihypertensives on hand. This needs to be addressed sooner than later, okay? You can, in the meantime, while you're waiting for EMS, you can give them supplemental oxygen and give them some support as you're waiting. But it's important that you get these patients to the emergency room right away, okay? Well, that was all about high blood pressure and hypertensive crisis. On our next episode, we can talk about low blood pressure and what to do with that. And continue to follow us for more medical emergencies and dental office tips. Thank you for following my channel. Take care. Bye.